Hi, I am Judy Chapea. I'm a physical therapist and I'm a clinical track assistant professor in the Department of Physical Therapy at the University of Alberta. I graduated from this program in the late 80s and worked clinically at the Glen Sather Clinic, which is a sports medicine clinic on campus, for 18 years. And the last 10 years I have been working here. So my degree was in physical therapy, a Bachelor of Science here, and then I've also done my Master's of Science also at the UofA, and then my PhD. So I'm homegrown. Well, I suspect I represent a big proportion. Actually, there's sort of three main groups that we see that come into this program. First of all, people that have an interest in the body that tend to go through phys ed and end up going through our kinesiology program. And then people that I would have fit into that were sort of science bound and were deciding between, you know, a career in probably medicine or physical therapy. And I knew that I liked science, I knew that I had an interest in the body, but the thing that I really knew was that I really liked working with people, and had a lot of influences in my life around the medical model. And actually my father, who is a physician, had said to me that you should go into physical therapy and not medicine because the desk will get in your way if you're a doctor. And that's kind of, you know, why I pursued this. I'll try to give one, but there's probably going to be about three. The first thing is, you know, our program is really hard to get into, and I think a lot of students, you know, they put so much effort into getting in and, you know, getting that academic average that they need to get in. And I always try and remind them that, you know, the reason that the program's hard to get in is it's actually a hard program. So I think the first piece of advice is know the program. So talk to students that are in it, that have recently gone through it, to find out exactly what that program is. Does it match truly the interests that you have? And then equally, if not more important, is really get out into the field, and not just one area of physical therapy, but you know, if it's MSK that you like, go and hang with some of those physios, but get a little bit out of your comfort zone and go to some of the hospital environments, long-term care. Really get to know the profession well, so that you really are very aware of what you're getting yourself into. Well, you know what, that actually was a really easy transition for me, and I think my role as a clinical physio in teaching patients and educating patients was exactly the same skill set that I needed to teach. And I also found that after you know, being in the profession for a long time, it wasn't that I was looking for something different, but I really felt like it was my time to sort of shift a little bit and start to actually give back. And it just felt like the right next step in my career. At the end of the day, what makes me the happiest is teaching, and actually being able to, you know, sort of follow a student's journey from when they first are learning something until they get to that point where the light bulbs start to go off. And that's very, very satisfying to sit back and watch that, and to be a small part of that. I also find that there's nothing that has challenged me more in my entire career than students. And that's because they are so keen and so thirsty for the knowledge, and they bring a freshness and a different attitude to it that, you know, for as long as I've been in this field, every single time I'm with a new group of students, it forces me to look at something differently, from a different eye, through a different lens, and that is a gift. Well, there's been probably a couple really big pieces that I could truly say have resonated through all my career. The first thing was actually very early in my BSc in physical therapy, and I had some really great mentor teachers that I sort of got to know a little bit better. And one of the things that I was taught very early on was to seek out your mentors, but to beyond looking for mentors, to really surround yourself with people that are better than you. And that may seem kind of odd, but the reality is if you're around a group of people, ideally it's nice to have people that are better than you and people that are, you're parallel with, and that is good for confidence, but you need to have people that are better than you, so you're always aspiring to that. So I was taught that early, and I was taught never to be afraid of that it is better to be with people that you will aspire and rise to that challenge than to be the best. That's never something you want to aspire to. The other thing, again, I feel really strongly about that I was taught was just always keep learning. And that may mean, that sounds so cliche, but really that may mean that you're looking at the same thing you've looked at for many years, but you're different. So when you approach a problem, at the beginning of your career, and then 5 years into it, you've brought so much more experience and expertise to that you're different. So your learning is different, and just be open to that. And then I guess the final piece of advice, which is very simplistic, is more relative to patients and students, really, is just to really give a damn, to actually, when you're doing something, make sure that you're doing what gives you that sort of sense of purpose, that you're actually in it because you care. And relative to patients, every patient has a story, and it's our privilege to hear that story and to really ensure that a patient is heard, and to really always be very grateful of that. That's it.